My name is Stefan Busch. I'm a Service Development Manager for NHS Westminster, and I work also really closely with Westminster City Council. The reason why my job is really in place is that people with learning disability have much poorer health outcome than the non-disabled population. In fact, some research told us that people with learning disability are 58 times more likely to die before the age of 50 than the non-disabled population. And often those are because of avoidable death. So we could prevent people dying in the first place. So there's a lot that we need to do to address health inequality of people with learning disability. We've done a lot already. We've got a very good contract in place with our local GP practices who proactively now invite people in for an annual health checks, and they also contribute towards health action plans.
What's happening this health check? I'm going to ask you some questions. Okay. And then I will check your blood pressure, I will check your urine, I will check your ears, and it will be a lot of questions, and your weight and height, of course.
That will be fine.
What we do, we're going to come up with a health action plan for you. So we're going to look for the next, say, for the next 6 months, to see what things you can do to improve your health.
No problem.
Because there are loads of people who can help you. And what we've done is we've used some unique public health data that we generated locally, and based on that we developed new services. And I'll give you some examples. One of them is around oral health. So we now invested with our oral health commissioner in our community dental service, and linked to that we have an oral health promoter who now does specific outreach to address people's oral health needs. So everybody in Westminster, on top of their health action plan, will also have an oral health action plan that will tell them about the right level of access to the community dental service. We invested in a sexual health worker. So for the next 2 years, we do a specific project around supporting people, A, to have the right to sexual expression, but also making sure that people do it in a safe way. So to actually ensure that people get the right level of support and information they need to form good, close relationship with others. We also invested heavily around supporting people around losing weight, because again, what local public health data told us, that a lot of our services are overweight and in fact obese. So we're doing a whole program called Choosing the Chance to Change, and we're working closely with leisure services, with dietetics, and with others to support people around healthy eating and access to physical health activity. We've also worked specifically with our secondary care provider, Imperial Healthcare Trust, and we're now investing in an acute liaison post for the next 2 years. And that's really to make sure that people who are vulnerable in hospital receive the right level of support, and that we kind of equip ward teams with the right expertise in how to work with somebody with a learning disability. So there's a whole host of different projects in place at the moment that we need to sort of implement to address the health inequality of people with learning disability in Westminster.